In my 2012 review, I explored the role healthy diet may play in preventing, treating, and reversing our deadliest diseases. In 2013, I covered our most common conditions. This year, I'd like to address some of our leading causes of disability. Heart disease is not only our leading cause of death, but also our leading cause of death and disability. Dr. Dean Ornish proved with his plant-based diet and lifestyle program that cardiac patients had 91% reduction in angina attacks. That's the crushing chest pain that some people with advanced heart disease can get. In contrast, control group patients who were instead told to listen to the advice of their doctors had a 186% increase in attacks. This marked reduction in chest pain was sustained 5 years later. A long-term reduction in pain comparable to that of bypass surgery, but without the knife, or the saw used to cut our chests in half. Forks over knives, soup over saws. But this was back in the 90s, when Ornish was only studying a few dozen patients at a time. How about 1,000 patients on a whole food, plant-based diet? Within 3 months, nearly 3/4 of angina patients became angina-free. 74% cured without a single scalpel or side effect. Now, Ornish didn't just put people on a plant-based diet. He also advised moderate exercise like walking. So how do we know what role the diet played? Well, if you go back to Ornish's first publication, he put cardiac patients on a quasi-vegan diet with no added exercise, just diet and stress management, and got a 91% reduction in attacks in less than a month. And Dr. Esselstyn was able to improve angina using a plant-based diet as the only lifestyle intervention, so we know diet is the active ingredient. But you know, they weren't the first. There are case series going back to the 1970s. We've known about this for decades. Angina and the vegan diet. Like Mr. F.W. here. Chest pain so severe, he had to stop every 9 or 10 steps. Started on a vegan diet, not even a low-fat vegan diet, and months later, climbed mountains, no pain. Now, there is a new category of anti-angina drugs. But before committing millions, billions of dollars to dishing them out, maybe we should take a more serious look at dietary strategies. To date, these strategies have been marginalized by the drug pusher mentality of orthodox medical practice. Presumably, doctors feel most patients will be unwilling or unable to make the substantial dietary changes required. Now, while this may be true of many patients, certainly not true for all, and in any case, angina patients deserve to be offered the plant-based diet alternative before being shunted to expensive surgery or drug therapies that can have a range of side effects and never really get to the heart of the problem. Now, in response to this paper, a drug company executive wrote a letter to the medical journal. Although diet and lifestyle modification should be part of disease management, he said many patients may not be able to comply with the substantial dietary changes required to achieve a vegan diet. So, of course, everyone should go on their fancy new drug called ranolazine, sold as Renexa. Costs about $2,000 a year to take it. But the side effects aren't horrible, and the drug works. Collectively, the studies show that at the highest dose, the drug may prolong exercise duration in angina patients as long as 33.5 seconds. It does not look like those choosing the drug route will be climbing mountains anytime soon.